The role of the cancer nurse in receiving CAR T therapy is to be educated regarding the therapy, know the side effects of the potential adverse events, and be able to educate the patient and the family during this whole period, as well as notification of the providers and the treatment team of the changes of that. It works from the trajectory from the beginning of screening all the way through to discharge. I think the nurse has a critical role with regarding keeping patients safe during this therapy. Well, the nurse's role in the CAR T therapy starts from the beginning, from screening, to identify the patient, find out what their resources are, to be able to plan and develop a plan that makes sure the patient will stay through the whole trajectory of the plan, from implementation of their leukapheresis to their manufacturing phase where they are being managed and keeping the disease under control, to their lymphodepletion chemotherapy, where patients are getting some chemotherapy in the outpatient setting. Then you get patients admitted to the hospital where they get the infusion, and the nurses are key in making sure the infusion goes well, and then for the monitoring of the symptoms of the cytokine release syndrome and the neurotoxicity. And then on discharge, making sure patients have all the education and the family has the education to make sure that they are safe at home and make sure they can recognize the symptoms and know how to identify the provider to make sure that they can report the symptoms so they can get back to the hospital if they need to be treated.